Hi, everyone. My name is Garrett Jones. I'm a general pediatrician at Park Nicollet, Brookdale Clinic in Brooklyn Center, as well as one of the co-chairs of the Minnesota chapter of the AAP's immunization work group. I'm also one of the lead collaborators on a nationwide AAP grant, looking specifically at improving the rates of HPV and flu vaccine rates here in the state of Minnesota. As part of that grant, we put together a series of 3 different webinars looking at different aspects and areas of vaccine hesitancy for those 2 vaccines specifically. The one today we'll be talking about is influenza, both the influenza vaccine, where we stand as a state, as well as what we can do to combat hesitancy and improve vaccine rates across the state. The others we've recorded as well as one is about HPV. And just so you know, some of the information within that about hesitancy and how to talk to families certainly overlaps between what we're going to talk about today. So be sure to check that one out. And then also the systems-based approaches. So looking not just about what we can do with an individual family in the office, but what we can do as health systems, as clinics, as bigger systems to improve vaccine rates across the state. So let's dive into influenza. So the influenza infection statistics, this is from 2019 through 2020. As many of you could probably guess, the 2020 data is a little bit not quite very representative of a typical flu season. And so the important things to know here, this is data by age category on the left. So looking specifically at incidence cases per 100,000, as well as number of hospitalizations. You can see the rate of that is very high. Rate of incidence rate is very high in the under 5 population. And then it's also important to be aware that influenza can lead to deaths. People don't often like to think about that, and this is even the state of Minnesota looking typically somewhere in the kind of 3 to 7 is kind of an average number of deaths within the state of Minnesota in the pediatric population. So low, but still there, and still something that we have to be aware of when we talk to families about the importance of vaccinating against influenza. So what are some of the benefits of influenza vaccination? So, and this is all just preaching to the choir, of course, but we want to make sure we highlight this, is it decreases the risk for pediatric death. So both in children with underlying medical conditions as well as healthy children. So this is important to highlight. Also decreases the risk for ICU admissions, again, by about 75%. The little graphic here on the right side is looking specifically from the CDC. So this is nationwide data. So looking in not just pediatrics, but I always like to kind of highlight this about if we did a better job of vaccinating, what could we do? So we've prevented deaths and hospitalizations in millions of flu illnesses. So we need to continue to push this, and it's one that often comes up. It's every fall. All of us are always talking about it, and so just sometimes knowing why it's important is so critical, so integral for us to have those discussions in the office. So remember the benefits, remember what we're doing when we talk about and feel like we are always kind of harping on influenza vaccination every fall and winter. So the importance of it. So where do we stand when it comes to flu vaccine? So this is data across the country. This is not just the state of Minnesota. And you can see here in the kind of pediatric populations that we do an okay job as a country. So we're about 63% are fully vaccinated for all the pediatric population. Now you can look at the young age group. It tends to be a little bit higher than that. Again, part of that is because it's probably because they come in a little bit more to the office, and two, and this is maybe speculating a little bit, but maybe we kind of push this a little bit more in the young population because we know how vulnerable they are to influenza. But certainly some work to be done, especially in that adolescent population. Where are we by state? So this lists all the states. Where are we? And we are just a little bit above average. So again, like we talked about in the last data, the US is about 64%, 63.8% coverage. We are 66.4%. So we are a little bit above the national average, but not by a lot, and certainly some room for improvement. This is specifically looking at vaccine rates by race and ethnicity type. And it's kind of interesting. So it does fly in the face of some of the concerns. So certainly we can see that the Black non-Hispanic population tends to be a little bit lower than the rest, but not too far Above that is our white population. Our Hispanic and other non-Hispanic population tends to do a little bit better. Again, this is big picture data across several years of flu seasons, but certainly there are some small but significant racial differences when it comes to who is being vaccinated against the flu. So this brings us to why is this happening? Vaccine hesitancy. It's one of the things we're talking about today. For those who have already watched the HPV talk, we talk a lot about vaccine hesitancy. As I mentioned in that one, it has been designated by the World Health Organization as one of the top 10 threats to global health back in 2019, and that certainly persists today. So what do we need to do to address vaccine hesitancy? It's important to remember that vaccine hesitancy is a complex multifactorial problem. It's not a one size fits all. It's not a everyone from even, it's not even an everyone from this specific ethnic group or this specific subpopulation thinks this. It's very, very specific to individuals and sometimes even individual within ethnic groups in different parts of the country, different parts of the world. It's very complex, it's very multifactorial, so you can't use a one size fits all model. So I have to think about it. So why do families refuse when it comes to, this is specifically looking at flu. So there've been some great data from the World Health Organization over the past few years, looking at why do families refuse the flu vaccine. So, and I've kind of broken it up into about 3 different major categories. One is safety and efficacy. So a lot of people kind of misinterpret getting sick with some sort of a cold around the time they get the flu vaccine as I got sick when I got the flu shot. Some people say, and these are all things that I've heard in the office, it won't actually prevent me from getting the flu. It's not that effective anyway. We don't need it. Flu is just a cold. It's kind of personal invincibility, as I call it. Kids don't get sick from the flu. I've heard people tell me that too. My family or I don't get the flu. I've never gotten the flu vaccine. I'm, 35 years old. I've never had it before in my life. So this kind of personal invincibility. And there's big issues with trust in the medical system. Oh, that's the one my grandmother told me not to get, or doctors are just doing that to make money. We've all kind of heard that one too, of course, unfortunately. So it's important to have this as a context as to why people are refusing when you see them in the office. So I highlighted this with the HPV talk. I don't want to spend too much time on it, but I do want to highlight it again. So what happens when we as providers meet resistance? We often don't want to take the time to engage with these families. We're uncomfortable with questions. Sometimes we just don't think we can change people's minds. I highlighted time and then don't think we can change people's minds, because those typically are the ones that, when you think of the flu vaccine, that are more commonly cited as why reasons that we don't engage. Takes time to talk to these families. And then certainly we just think, you know what, they've got it set in their mind. They're not going to get the flu vaccine today. So what am I doing? I don't need to waste my time doing it. I mentioned patient-provider communication is key. Being presumptive, being a little persistent, like we talked about the HPV, is also important. Listen to concerns, reshape the discussion. So make sure we're not kind of touching on some of the hot button topics that can be around the flu vaccine. So we'll need to shift the focus, talk about the kind of parts of it that are effective. And we'll kind of delve into that in just a few minutes. Scare tactics, okay in small doses, and to correct misinformation. Like, oh, children actually do get sick from the flu, and several children in the state of Minnesota can die from the flu every year. That's okay if you start showing big graphs and pictures of people on ventilators and that kind of stuff from the flu. It doesn't really been shown to be very effective. Beware of the boomerang effect. Again, we'll kind of touch on that in just a second, but the boomerang effect is a psychological phenomenon where people tend to retreat to their previously held beliefs when they're met with a lot of counter data. And so just kind of beware of that, so we kind of tread a little bit more lightly sometimes with these discussions. We want to make sure we start with presumptive language. Looks like your child is due for a flu vaccine today. Looks like they haven't had their flu shot yet this year. Let's go ahead and give her the flu shot today. It's kind of presumptive, assuming they're going to say yes to the vaccine that you're recommending, instead of the participatory way, which is, oh, how do you feel about getting the flu vaccine today? It's a little bit more, I say, wishy-washy. It's a little bit more passive and not as kind of strong. And what the kind of the undercurrent of this is, when parents hear presumptive language, they know that this is important. We wouldn't be doing this. I wouldn't be kind of using that presumptive language if I didn't think it were important. On the flip side is, when parents hear the participatory the participatory language. They hear, maybe it's not that important. Maybe I don't need to do that. Well, they're asking me my opinion. Can't be that important. They don't ask my opinion when the, my doctor doesn't ask my opinion when he says my child has an ear infection and needs amoxicillin for that. Why are they asking me my opinion now? So maybe it's not quite as important. So that's why we want to always start with presumptive language. We'll just briefly run through this. We talk about it a little more in the HPV talk, but there's been some great data showing that using presumptive language increases vaccine acceptance, same-day vaccine acceptance. And even when we meet a little resistance, if we push a little bit, not too hard, we get into that boomerang effect, but push a little bit, it has been shown to improve same-day vaccination rates as well. So be presumptive, be persistent. And this study, again, out of 2013, did look specifically at families who identify as vaccine hesitant or vaccine concerns. So it works even in those who have concerns. We want to make sure it's okay to challenge myths. We don't want to be kind of, delving too much into this kind of myth buster. Everything they say, we've got a counter offer, counter argument. Because again, that gets into that boomerang effect where people retreat more to what their strongly held beliefs. It's okay to do this appropriately. And how do we do it appropriately? We focus on a few key facts. We don't want to just overload data dump people. We use simple, clear language. And if there is an alternative explanation, this is a good one. So thinking about flu, like, oh, last year I got the flu vaccine and then I got the flu a week later. Well, you can say that, the alternative explanations could be, well, it's just kind of, it's viral season. It sounds like you may have had a cold. That is not something that would have been prevented by the flu vaccine specifically. Or it could be that, oh, you got the flu, even if you did get diagnosed with the flu the next day, there wasn't enough time for the vaccine to work. So it's okay to offer those alternative explanations, because that sometimes gives people something else to latch on to when you're kind of meeting their, trying to kind of break down some of their previously held beliefs. Reshape the discussion. Find common ground is so important, because sometimes people think this is, both providers and families feel like this is a us versus them discussion, us versus them kind of in a way, almost a kind of a fight, a kind of an argument, more or less. When we find common ground, we start to break down that barrier. I always say, build the empathetic bridge. So I know that we both want your child to be safe and healthy this flu season. Again, kind of reach across the aisle, showing that you care about their child. Focus on the benefits of the flu vaccine. Talk about how this decreases the rate of hospitalizations, decreases the rate of flu deaths, all of that, even in kids who ultimately get the flu. So talk about those benefits. Address the myths, misinformation, be respectful. And this is a great place to discuss your own practices too. I make sure that my children get their flu shots every year, or I got mine. Look, I've got the little tag on my badge that says I got my flu vaccine this year. So people want to know that we are actually practicing what we preach, that we're walking the walk and not just talking the talk. So know that. I love this quote from the CDC. Flu vaccine is the first and best way to reduce your chance of getting the flu and spreading it to others. So this is a good way of doing that. So again, it's not saying that this is 100% effective. What we're saying is it's the best way to reduce your chances of getting the flu. We'll talk a little bit about motivational interviewing. Motivational interviewing, as most of us in pediatrics know, is a way to shape a discussion to try to get the person across from you to make a decision that that they may not initially be wanting to make, but maybe it's better for their health. So we use this frequently when it comes to things, for example, like adolescent obesity, smoking, all sorts of things like that. We want to make sure that the person across from us is the one who's making that different decision. So we can use those same kind of tactics when it comes to the flu. When it comes to vaccine hesitancy. And one of the ways it's been shown to do that is what's called the case method. The case method is actually a framework for a discussion with a vaccine hesitant family. It was developed by people who work with autistic families, and looking specifically when it comes to the concerns with MMR and autism. And so people in the autism, I believe is the Autism Speaks group that developed this case method. So what does it stand for? C stands for corroborate. We want to acknowledge their concerns, build the empathetic bridge, find the common ground, kind of like we talked about just a few minutes ago. So this is really important. And I should highlight before we go too much more into the case method, it's not a one size fits all, and it's not a checkbox. It's not a boom, 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 I did all these things. It's more about how to frame a discussion. Keep this in your mind as the discussion is going forward about kind of how to shape things. A is about me. Why are you an expert? Why should you be trusted? What about your own research? Do you study the flu vaccine yourself? Do you look at the data? What do you do? Like, do you do your own practices? Do you, like I said, talk about what you do for your children, talk about what you do for yourself. S is for science. We want to, I always say caution. Science is good. We all love science. Not everyone does, though. Not everyone wants to hear all the nitty gritty, kind of nerdy details about vaccines and vaccine science. So if someone has a concern that seems to be rooted in some sort of a science basis, or like a safety concern, it's okay to talk about that, to address it, but I always say layer it. So if someone says, I'm worried that the flu causes me to get influenza, so the flu vaccine causes me to get influenza, you can say, well, no, it's not how it works. It's not a live virus, depending on which one you're giving. It's not a live virus. It doesn't do that, and you can just leave it at that. Sometimes people want to know more. They want to get really into the nitty gritty about live viruses and all sorts of different things. But frequently, they just want to know that it's safe. They just want you as their doctor to tell them that it's safe. So layer it. So give a little information and then pause. Let them respond. And if there's still concerns, talk about that next layer of science, and then stop and pause. E, that's for explain. I like to say advise. Make sure at the end of the day we're strong with our recommendations, that we are clear. People aren't leaving the room saying, "What just happened? That was all over the map." And so make sure that you kind of tie it up in a neat little bow. And when people still say no, what do we do? It's not necessarily a win or lose kind of thing. I always like to think about this as more of building relationships. So even though someone may say no to the flu vaccine or any other vaccine that day, it doesn't mean that the next time they come in, they're going to say no again. So one, we want to make sure we talk about it again. Make sure we direct people to appropriate resources. CDC, MDH, Children's Hospital of Philadelphia has some wonderful data for those families who are a little bit resistant to some of the government-based resources. So all of this are great resources. At the end of the day, like I said, what we want to make sure we're doing is creating a pro-vaccine environment, creating a safe space for people to talk, people to ask questions, and for us to connect with families, because that's the most important thing. That relationship that we have with our families is the number one and best indicator for whether or not a family is going to say yes to vaccines. And so sometimes we have to check our own preconceived notions at the door and sit down and talk to that family. And again, don't think of this as a win or lose. Think of this as building a relationship that even if someone says no today, that we talk about it next time, because that's such an important thing. Thank you guys very much. If you have questions, please feel free to reach out to me at any time through the Minnesota chapter of the AAP. Also, be sure to check out the other webinars we have recorded, the HPV, as well as the systems-based approaches as well. We'll be doing some more outreach as part of this grant as well, looking at other ways that we can help address vaccine hesitancy, as well as improve our vaccine rates, both for HPV and flu, here across the state of Minnesota. So thank you very much.